Please welcome President of ClearArch Health, John Bojanowski, President of Advocate Aurora Enterprises, Scott Powder.
Good afternoon, everybody. Thank you for joining our short session. We're going to be talking about when innovative health systems combine with value providers and to push the boundaries of traditional care delivery. So my name is John Bojanowski. I am the president of ClearArch Health. On April 1st, a press release was issued that our company, ClearArch Health, and our parent company, Mobile Help, was acquired. So why is that a big deal? You see this a lot. Digital health companies, telehealth companies, RPM companies getting acquired on a regular basis. What's different is about who acquired us. That was Advocate Aurora Enterprises. So why is that important? Historically, remote patient monitoring companies like ours, ClearArch Health, have really focused on post-acute episodic care. And over this period of time, you can see some of the data that we've been able to deliver. Mostly 30, 60, 90-day episodic care. Great outcomes relative to reducing readmission rates, reducing ER visits, and increasing patient satisfaction. But however, a few weeks ago, I was having a conversation with the CEO of a very large cardiology practice. As I was sharing some of these industry numbers with him, he asked a really important question. And that question was, well, what about after that 30, 60, 90 days? What about 2 years from now? What about 3 years? How are those patients doing? And so we believe there's an important story in this. And how does that tie back to our acquisition by Advocate Aurora Enterprises? We are now tied to a system, which is Advocate Aurora Health, that is one of the leaders in value-based care. It gives us the opportunity to really look at how we move beyond these simply the post-episodic cares, the post-acute cares, and how do we move into more true transitional care. And so we're really excited about it. So when you look at this data, we're going to be able to challenge ourselves in terms of how we move this forward, how we work together with a large provider, and how we deliver a meaningful change to deliver the right patient, the right care at the right time. So we believe that this next step and this relationship we now have will help us pave the way for the next wave of remote patient monitoring. So at this point, I'd like to introduce you to my new boss, President of Advocate Aurora Enterprises, Scott Powder.
Thank you. Thank you. I haven't ever been called boss before, especially in my own house. I'm definitely not the boss. So, but it's a delight to be here, and we are so excited to welcome ClearArch and Mobile Help to the Advocate Aurora Enterprises and the Advocate Aurora Health family. So. Let me just say a word and kind of build on what John just said and give you a little bit more context for why did we do this? How does it fit? What are we trying to do? Where do we see healthcare and health going, quite frankly, over the long term? So a couple words. John mentioned this, but it's worth reinforcing. Advocate Aurora Health, which is our parent company, we're one of the largest health systems in the United States. We serve about 3 million people every year. Of those 3 million people, roughly half of them come to us in some form of value-based contract. Of that 1.5 million, roughly half of them come to us where we have most or all of the financial risk associated with their cost of care. In effect, while we don't have an insurance license, we are the health insurer in many respects. And our job is to keep people well, keep people healthy, avoid high-cost episodic acute interventions, So if a person ends up in one of our hospitals or one of our emergency departments, that is a failure of the healthcare system. It's our failure, and we are at financial risk for it. So as you might expect, with the advent of new technology, some of it pioneered by Mobile Help and by ClearArch, more and more of our care is being done outside of our hospitals. So on a revenue basis, our inpatient activity represents about 30% of all of our revenue. We're a $13 billion, maybe $14 billion health system. And only now about 30%, down from 5-7 years ago when it was 50%. That hides a little bit of the trend, though. If you look at patient volume, on any given day today, we have probably 3,000 to 4,000 patients in our hospitals. We have 25,000 patients, so nearly 10 times the number of patients in our home health settings where we're taking care of people in their home in some form or fashion. So far more activity happening outside of the walls of our hospital. And I didn't even count in our ambulatory and physician offices and settings like that. So we believe part of it is because of value-based care trends, and part of it is that's where people want to be treated. More and more things are going to happen in the home. So one of our big investment theses, and one of the reasons we created Advocate Aurora Enterprises, is to be a subsidiary of the parent company and invest in companies, technologies, and services that are really outside of traditional clinical care in new care settings and that are focused on consumer health, things that consumers are investing in to take care of their own health. Our purpose as a system is not to just treat your specific medical needs, but to actually help people live well. That implies being accountable for and helping partner with people to invest in and improve their overall health. So Advocate Aurora Enterprises was created to actually help that journey for Advocate Aurora. So let me say a little bit more. We are focused on consumer health. I would say the top of this slide, the top two, is part one of our mission and our vision. We want to impact health at scale. So Advocate Aurora Health serves 3 million people. Advocate Aurora Enterprises, through our portfolio companies, 1 year in, so we're only a year old, now serves about 500,000 people. So we are on our way. My guess is in the next few years, we will be exceeding the number of people we touch through Advocate Aurora Enterprises compared to that the legacy clinical care delivery system. We know that access to great clinical care impacts a person's health, but there's a lot of other things that impact a person's health even more. Food, nutrition, exercise, sleep, things of that nature, being safe in your home, avoiding accidents, all of those things. We also know that if you're going to impact a person's health, you need to interact with them more frequently, longer duration, with a deeper engagement. So I like to say I interact with Advocate Aurora Health, who provides my clinical care, in a good year, 30 minutes a year. That's when I go see my doctor, and I'm being generous when I say 30 minutes in my annual physical. I interact 90 to 120 minutes a week with my fitness provider. They know a lot more about my health than my healthcare system does. That's what Advocate Aurora Enterprises was set up to do, acquire and invest in companies that are outside of, but adjacent to clinical care, impacting a person's health and have much deeper interactions. That's why we love what ClearArch and what Mobile Help are doing. So they are in over 300,000 households, oftentimes for years. I think the average engagement with our client is something like 40 months. So that's a much different engagement than what happens in the traditional clinical care setting. Part two of what we're trying to do is impact the health of our parent company, Advocate Aurora Health. Clinical care delivery is a brutal business. It's capital intensive. Costs are going up, and generally utilization and reimbursement is not. That's a tough business. So part of what we're doing is tapping into that consumer health economy. And so in our Mobile Help ClearArch world, Mobile Help actually gets paid by the consumer through a subscription model. Now ClearArch gets paid by the provider to bring technology into the home, but again, to keep people safe. And our job at ClearArch is going to be to extend that relationship, as John said, beyond a 30, 60, or 90-day episode and make it work over the long-term, long-duration relationships. So we're really excited about this, and it fits a couple of investment themes that I want to talk about for 1 second. So as I said, we were created about a year ago to invest in innovative solutions outside of clinical care, again, trying to help people live well, impact a person's broader health. I said our vision to be a national leader in consumer health, and we're trying to create synergy between and amongst our portfolio companies and with our kind of clinical care delivery system. We think that can create a unique ecosystem that's innovative and helps people live well. So that's what we're trying to do. And here's where this all fits together. So we've identified 3 big areas where we believe we can impact health. The one that Mobile Help and ClearArch fits in is aging independently. So this is where our thesis around home-based care comes in as well. We believe the home should be the hub of most care delivery. And if you look around and walk around this floor, there is so much technology out there that's going to enable a lot more things to be done in the home. I understand we're not yet doing brain surgery and heart transplant in the home, but we are doing a lot of stuff that we never did before, all enabled by technology and the ability to move information to clinicians even if they're remote. So that home-based care, home as the hub, becomes the basis for allowing people to age independently as long as possible in their home. As I like to say, if you survey 100 seniors, I guarantee you that 100 seniors, 0 seniors will say, my goal is to live out my remaining days in a nursing home. 100 will say, I want to be in my home, but I need to be safe. And the loved ones, the surrounding family, need to have peace of mind. That is a major area of investment for us. So we've now made 2 transactions in that space. The first one was a year ago. We acquired a company called Senior Helpers. They are in 20,000 households any given day. They provide in-home personal care services. So it's a set home health aides and the like who are coming into the home. The average relationship is 9 to 12 months, 20 hours a week. So again, a much more frequent, longer, and durable relationship. We're in the home, labor-based solution, providing support for activities of daily living, light-duty household chores, companionship, and again, that layer of safety that comes with having a person in the home. Now we've added to that Mobile Help and ClearArch. So now we have not only a labor-based solution, but we have a technology solution. We have, through Mobile Help, a personal emergency response capability that if something happens in that house, we've got a cellular-based device. We also have an embedded fall detection, and we have a hub that can trigger an emergency response if one of our customers is in trouble. We augment that with the ClearArch solution, which is our remote patient monitoring. So one of the things that Mobile Help pioneered 14 years ago was disconnecting personal emergency response from the home phone landline, and it's cellular-based, and they can process signals through that cellular technology. So now we process all kinds of biometric and vital signs. We integrate it into a hub. We feed it to the clinical team who are doing the actual clinical monitoring. We can feed it to the loved ones and to the client. So you marry all that together, couple it with a team of people at Senior Helpers who can go into the home and provide hands-on support. We're starting to build a bundle of services that we think can allow people to age independently for a much longer period of time. And again, as I walk around the floor and look at some of the emerging technology, we're only going to get better at filling in those gaps of information that we need. My dream is that, and I said this to someone earlier today, I think my grandkids, and my oldest child is 23, so I'm not yet into the grandparent phase, but I will be a grandparent someday. I'm going to guess my grandkids are going to be continuously and passively monitored, and they're going to have a layer, they may not even know it exists, but a layer of care and support and for them as they age over time. And I think that's the direction we're going as I look out on this audience and out at the floor and listen to the sessions. So it's an exciting time. Advocate Aurora Enterprises now partnered with Mobile Help and ClearArch, and of course with our Senior Helpers team. We're on the cusp of some great things in terms of supporting people in their home, keeping them safe, which is where they want to be. And on that note, I thank you for your time. And if you want to know more, we are right out there in the 1200 section. Clear Arch is a place you can learn a lot more about what we're up to, and we hope to talk to all of you. Thank you very much for your time.